So, greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, I'm very, very pleased to welcome Patrick Pickarts. Patrick is a nurse executive. He's a healthcare leader with expertise in the fields of health administration, operational management, information technology, and informatics-based solutions. So, welcome, Patrick.
Thank you. Thank you, Dale. Glad to be here. Long-time listener, first-time caller.
Thank you so much. And thank you so much for doing this. I really appreciate it. I love talking to nurses. So, thank you. First things first, why are you a nurse? What made you become a nurse?
So I have an unoriginal story about becoming a nurse, which is that my mom is a nurse and my sister is a nurse and healthcare family, which I think is just, again, I wish I had something more like profound to say about it. But I never felt pushed into the career either, and I always knew that I could be what I wanted. But it was interesting. At my family's dinner table, people would talk about their workday and interesting cases. My mom worked in the ER. My grandpa was a primary care physician. He's not with us anymore, but that was in the day when a primary care physician was kind of like the OB doctor and the ER doctor and the inpatient, and just
Yeah.
really interesting things. And I was like, wow, like it's just always been a fabric of me. But I've been a nurse for 15 years, and I think that I just had a nice glide path from my family. And I saw my sister doing it in nursing school, and I thought, well, I'm smarter than her. If she can do it, I can do
Oh,
it.
it was a sibling thing, huh?
Yeah. And but I will
So,
say, I started as a nursing assistant when I was trying to think about what to do and beginning with college. And I thought, well, if I can handle being a certified nursing assistant and Happy Nurses Assistant Week belated to everybody. But I thought, well, this is kind of like the entry level piece, and it's probably up from here depending on how
Mhm.
far I go. And I liked that too.
So, having listened to all those stories at your dinner table and having so many people in healthcare around you, when you became a nurse, though, what was the biggest challenge for you?
Gosh, I was a country bumpkin. I grew up on a farm in Wisconsin. I went to nursing school at University of Wisconsin-Madison, which was a great school, and to me was it might as well have been Paris or London or something. It was like a huge metropolitan city to me. Um, so after my nursing school and being in more of like a sheltered community where I said I was a nursing assistant, was at a lovely community hospital. Wanted to move to Chicago. That was like the next big thing. I'm going to do it. I was 22. I think a lot of 22-year-olds just decide that they're going to do something. And I feel like the older you get, the more you look before you leap. Uh,
Mm-hmm.
I wouldn't do that, so quickly right now. So it was a big challenge just being someplace totally new, knowing that you had to make it. I had accepted my nursing job without I hadn't passed my boards yet. I hadn't taken them. So there was kind of just this pressure, like, all right, you already moved here, don't mess it up. Um, and then, gosh, compound response. My first job, I was eaten. I was one of the young baby nurses that was eaten by their young, right, as we say. So I think just kind of like trusting my intuition and my sixth sense to know that that hospital wasn't where I belonged and that there was someplace better for my talents and being fostered. That was really difficult because, again, I didn't have any breadth of knowledge or experience. I thought maybe
Mhm.
all nursing jobs would kind of be like that. So I was, I think that piece, yeah, I never thought about it that way, Dale. That was a good question.
Yeah, I know how daunting that can be. I mean, I left home. I grew up, I guess, kind of like you because I grew up on a really tiny, tiny Caribbean island. And I left home at 18 to go 3,000 miles away to England to go to nursing school. And so I get what the challenges and the trauma can be.
Yeah, and it was it
Yeah,
was
that
it
is.
was fun, but
Mhm.
I think it's also different too, like now in your career or my career or not, like most people's careers, you could say, all right, this is a bad place. And because
Yeah.
I've worked at five other places before, I know that I need to leave, or, this person is a wicked, horrible person, and that's fine because I know what I'm doing. I'm not a novice, and
Hmm.
they continue being miserable, and I'm going to keep on shining over here. But right, you really need your community and your
Yeah.
preceptors at that time. So,
Yeah.
you know,
Absolutely.
spoiler alert,
Absolutely.
I survived.
That's the thing about nursing, though, you're either going to sink or swim.
Yes,
Yeah.
yes. And somebody said to me recently also, just about nursing in general, if this is the type of job that you could master in 2 weeks and you wouldn't like it anymore. None of us would like it anymore. Everybody likes the growth and the challenge, and
Hmm.
sometimes we hate to love it. But
Yeah. It's a good way for the way it's a little bit sometimes. So what kind of areas did you work?
so my base and backbone, emergency nursing, my best ER job. I give a shout out to St. Mary's Hospital in Chicago. That was where I worked from right after the hospital that shall not be named that I disliked. Um, I worked there for about 5 years in the ER, and it was a great experience because all ages. I was taking care of a baby, then a 100-year-old, then a 50-year-old. Really interesting population in Chicago. It was where like five different neighborhoods were connecting. One side of the neighborhood was very different socioeconomically
Hmm.
than the other. So my
Hmm.
background is ER nursing, but it's really kind of in that particular ER at that time at that place. Uh, I just kind of feel like I got is a lot. I was oftentimes a makeshift, ICU nurse, which is only probably getting worse and worse for the ER nursing workforce now. But that's
Hmm.
my backbone, and I kind of don't have the attention span to do a lot of other, inpatient and ICU nursing practices that I have a
Yeah.
huge amount of respect for, but I know that I'm not one of them.
So are you still in ER?
I am still in ER on a very registry part-time basis.
Mm. Hmm.
There was many years where I was doing 100% informatics and riding the wave of doing Epic implementations. My day job right now is working in software and tech. Um, and probably from working in that same ER, and I think we can all relate to this, being a staff nurse or being really kind of like the frontline shift worker, and having well-meaning bosses that are just really tone deaf, or just like, what, you want me to do this, or I'm already stretched so thin and now I have to do this extra form or assessment or administrative task. I really try hard to stay close to the work and not forget how hard it is to take care of patients, because
Yeah.
the further, I don't want to say
Yeah.
up in different areas from direct patient care you go, the harder it is to kind of stay real.
Yeah. 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 And so what is the biggest thing you think you'd like to see change though, as far as nursing goes?
Gosh, I mean, I'm taking a moment to pause because I want to give you a really good answer, Dale, that's also sincere. I want nurses to be, I would like to see the business acumen of nursing workforce increase. I
Mm.
think that it's an industry that oftentimes has just kind of done everything for the love of patient care and being doing the right thing, and being that angel of mercy.
Yeah.
And those are all wonderful things. But I think that the world and the healthcare industry has oftentimes taken advantage of that. You just being a cost to a
Hmm.
hospital or take care of a patient. Not knowing what the cost of an ER visit is, or how a hospital is necessarily reimbursed, pieces like that. So I would like nurses to keep on rocking it out, but also really kind of understand like the value proposition that they're doing, and really understand that a hospital and healthcare is a business, and that we're um, not helping ourselves in any way if we don't also get on board and know that. and right, no money, no mission. So even if you want to say, but I just want to take care of my patients, I just want to do this, well, you still have to understand the economics of it, even if it's not your favorite thing.
Yeah, exactly. I'm so glad you articulated that. I really am, because that is a huge thing. One of the things we complain about is that people who are making decisions for us don't really know what we do. But at the same time, we have not been able to marry or attempt to marry what we do with what they do, and what how they come to their decisions and how those decisions affect us. And probably if we knew better, we'd probably be able to communicate better to them what we actually do need and how we need it.
Yes, yes. I think thinking about your grievances or your complaints, or maybe it's just, I don't want to put a negative connotation on it, maybe just like a way that a hospital can do better. If you think about
Mhm.
like, well, how is how would you make a business case to a chief financial officer, or how do you show that if we, how do you really do again, I'll say it twice, value proposition buzz term, how do you show that if we do X that you will yield Y?
Yeah,
I don't think that nurses are necessarily trained to do that outside of giving like a SBAR style patient report.
yeah,
Uh,
yeah,
you know,
yeah. Absolutely, absolutely. And you know that that really is one of the reasons that I asked that question about what we would like to see change, because we have to be the instrument of whatever changes in nursing. And that means that we have to learn a few things.
exactly. Yeah, and not just be like completely dogmatic that
Hmm.
like this is how we always did it, so we're gonna do it. And this is a way that I have to keep my muscle memory toned, that there's a lot of things in nursing broadly that have just kind of always been done a certain way, and subtle things that really aren't very disruptive are actually very disruptive to like a nursing process or a nursing care
Hmm.
model. So
Hmm.
so that's the
Hmm.
balance, right? Knowing what you know and then using it to like help the broad workforce, but then
Yeah,
being out of touch, with one versus the other, not being too administrative or too IT or too whatever, or
yeah.
just too nurse with the blinders on. Oof.
Yep, yep. I get it. I get it. And so you are, so you've done informatics and all of this, and now you're getting yourself involved in um business, in entrepreneurship, right? Or you're becoming involved in this.
Becoming involved. I have my my little side project that we'll talk about, maybe like if you have me back on your podcast in like a couple years, or if you do something like how Oprah does, like Where Are They Now on her TV show. But right now I'm working for I'm not the entrepreneur nor the CEO, but I'm have a kind of a product that I consider to still be my baby, demand workforce. And not to sound pitchy in this
Mhm.
conversation, but it goes back to just making a little change that actually can be, cause major waves in a positive way across a nursing workforce. So traditionally, right, in hospitals, there's an open shift all day, every day. You call Dale, you call Patrick, you text us, you phone a
Yeah,
friend, think about who's going to be the most like, um, who your emotional plea to come in and work is going to be most receptive to. This software is a tool, simple tool, lightweight, easy to put in, put out your open shift needs through it, put in some incentives, make it a little bit the Uber of nursing, but just broadly get the message across, get it to everybody who qualifies for such a shift. Maybe if you're working in an ICU at a large hospital, there's ICU nurses that are qualified and you don't even really know who they are. Just get the word out, bother people less, be more respectful about how you contact your staff, up the rate a little bit, right? Again, this goes back to our
yeah,
economics piece,
I-
Dale. Nurses are just
yeah.
taught to historically do it because,
Mhm.
for king and country. Now it's like, well, how about giving Nurse Dale an extra,
Yeah,
$20 an hour to come in and work? It's how every other industry works. Um, so there's that piece about getting a return on investment with such a software and a tool. Helps hospitals save money on premium labor, right? Premium labor is the buzz term we call
yeah.
agency and travelers.
Hmm.
But to me, I like this because it takes the nursing brain, the tech space, and just kind of offers a simple solution that helps. No silver bullets, but it's a helper tool,
Yeah.
and I like helping the workforce broadly. So it's a passion project as well.
And this is currently just available where?
It's a product that's available at basically any of my client hospitals that have purchased the software.
Nice.
So it's something, it works, a hospital system buys it, they implement it at their hospital and share it with all of their nurses. So all your nursing staff on their phone will get, a push alert that there's a shift
Yeah.
available for something that they qualify for. It's not something that's open air market or you can just download it and pick from
Yeah.
different
Yeah.
hospitals. That's not what we offer, and that's kind of just a different way of saying agency, but not being an agency nurse when you can do those kind of things. All the
Yeah.
love to agency nurses, just not all the love to some of the corporations backing certain agencies.
Mm-hmm. Mm-hmm. Got it. Got it. Got it. I love something you said when you were talking about that, and you talked about, looking for staff and thinking about who's going to respond the most to your emotional plea. And that is something that we do. And that is something that I wish we would stop kind of doing, because it effectively you're guilting someone into coming in. And that's, to me, that's just so wrong.
Uh-huh. Yes, it's like nurses using their psychological nursing training at its
Yeah.
worst, using like the
Yes.
developmental psychology and such. It's like it can be borderline harassing, and I have received both ends, right? I've been the charge nurse, please, can you come in?
Yeah.
I'll make it so fun for you. We can order from wherever you want. And remember, I said I was in that ER that was where like 5 different neighborhoods converged. There was really great food choices. Uh, yeah, and right, everybody knows like when their hospital is calling them at 5 in the morning or 11 at night, like you know why the phone's ringing.
Mm-hmm.
You know
Yeah.
what they want.
Yeah, exactly. 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 So I mean, nursing now kind of is like exploding in all kinds of ways. And I think back, so for me, as opposed to for you, now, just this past May, made it 49 years since I've been a registered nurse, right? So I think back over those 49 years, and in the last 10 to 15 years, nursing has made such great strides, and exploded in so many different ways. What do you think you see in the next 10 years or so?
Yeah, right. I have like the chills on my arms right now. So I think that there will be what I think we all kind of know to be true is there'll be a lot more virtual nursing
Mm-hmm.
opportunities. I think that that's something that's really um I don't think it's like necessarily prophetic for me to say it because it's already happening.
Mm-hmm.
So lots of growth in that space, and right, we all say during pandemic telehealth grew like 30 years in three
Mm-hmm.
months. So I see the technology piece growing. I see there being a lot more virtual nursing opportunities for nurses. And I mean virtual nursing, not how I work in software or IT, but that maybe I'm here giving someone like you your discharge instructions from a clinic because they have like one nurse physically working
Yeah.
in the clinic and
Mm-hmm.
doing skills and hands-on, and then just a division of labor in a way to kind of attract more nurses to the workforce and have better retention. That Patrick is doing a remote day and people just kind of call into my line and get their virtual care. So I would like
Yeah.
to see that grow, and I think that the industry really deserves it. I know there's a lot of really hardworking nurses that I would like to see not have to like work a 12-hour shift that turns into a 14-hour day after day. But I also really want to see, this is where I am being hopeful, is I want nurses to step up to the plate broadly and be leading all of these new initiatives, and being on the boards or being at companies that are doing this tech. We'll always need the very
Yeah.
smart technical people to be helping create the vision from like the whiteboard.
Yeah.
But I don't want uh, tech companies that I don't want I don't want people that don't take care of patients to be shit telling us how we're going to take care of
Oh,
patients. So I want nurses to
it's
be at the forefront of all this change.
Yep. I absolutely agree. I absolutely agree. I've been telling people recently that I really want to see a nurse be surgeon general. Just because I think we can.
I think so too. Yeah, and people don't. I mean, you know what I know, but like this, there is a good amount of nurse CEOs, and I love that.
Yes. Yes,
I think it's
absolutely.
awesome. I mean, I don't even really know very many personally right now, but I'm always just kind of like, yes, when I see that on LinkedIn or at a conference or something. I just, yeah,
Yeah,
we're very pro-nurse,
absolutely.
if you can
Ab-
imagine, on Nurses Talking podcast.
Yeah, indeed, indeed. So what advice though would you give to someone who wants to be a nurse now? Because there's a lot of those of us who are nurses and who are in have been in the trenches kind of know what we know about nursing. There's a lot of negative stuff going on outside, and some people who want to be a nurses might think, I'm not so sure. What would you tell them?
I would still recommend the career hands down.
Hmm.
I love being a nurse. I miss every day, not like working in the ER or like working in a hospital. And that's easy to say when you're not doing it full time. I've also been burnt out, but I would encourage. I think it's a huge platform that's only growing. We're becoming more of an endangered species. Um, I would want nurses, novice nurses, to know that there's many things you can do, which, and again, thanks for doing this Nurses Talking
Hmm.
YouTube channel, because I think it's probably like one of your tenets of doing it, that nurses can do anything.
Yeah.
So, start out, get your experience doing, hospital or clinic or whatever, and just know that that's your ticket to be doing really whatever you want throughout your career. I'm
Yeah.
15 years deep. I have more, I have hopefully many more years left to be doing new things, but I never thought I would be doing IT or software. I do nursing content writing sometimes.
Mhm.
It's just, it's phenomenal. So I would want them to know that there's a very extensive menu,
Yeah.
and also that it's a tough job. Don't go in and
Hmm.
think that you're just going to
Yeah.
be like a healthcare hero. Like, have some grit and stamina, and
Yeah.
you know
Yeah. Yeah. And discipline. And discipline.
discipline. Yes, and
Yeah.
I don't know. This is, I guess, if I may ask you a question, Dale. I don't know if that's
Sure.
against the rules, but that makes me wonder. Right now, there's a very multi-generational nursing workforce that I think is much more. You're side by side in a hospital or healthcare system with 20 somethings, 30 somethings, 40 something, 50 something, 60
Mhm.
something, sometimes 70 something. I don't think that really happens that often. And the playing field is oftentimes somewhat level, right? You'll each have your assignment, or you'll each be kind of tasked with doing maybe similar things. I mean, is that fascinating to you, or?
Absolutely, absolutely. Because as you said, there are so many different generations involved, and we bring so many different kinds of things to the table. So, for example, when I became a nurse, my nursing education looked a lot different than I'm sure yours did. Um, and I became a nurse in the United Kingdom. And at that time, there was a lot of emphasis that was placed on your clinical experience. So while you did have a lot of didactic, a lot of theory, and there was a lot of in school work. There was a lot of that word is escaping me right now. There was really also a whole lot of clinical experience and a whole lot of benchmarks, many benchmarks that you had to meet before you were allowed to even, progress further. Which meant that once you became a staff nurse, once you became a registered nurse or whatever, you already had a lot more of the confidence and a lot more of the experience clinically than some other people did. Now, over time, that model kind of changed, and people started to focus more on theoretical things and on critical thinking things. Although, once you were doing it, you did have to think critically, but it focused more on a shorter clinical experience and preceptorship and stuff like that. So we had registered nurses coming to the table who experienced a lot of that new grad anxiety and all of that kind of thing. And so when you have all these different levels of people, all these generational levels, you have people with different levels of education, B experience, and all of this kind of thing. Patient you're taking care of has no idea about all of this. All they see is, I want a nurse, and a nurse will come to me, right? And so somehow we have to support. And one of the things that I really admire about younger nurses actually is their resilience, because very often they walk into a situation where nurses have been there for a while. You have experienced nurses, and new nurses are coming in with some different ideas, new things that they have learned.
Mhm.
And sometimes they're coming up to someone who says, well, this is not the way it's done. That was in school. This is the real world. Well, maybe that was in school, but somehow you can listen to what happened in school and learn that the real world is changing. The type of patients you have are changing. The expectations are changing. Your management systems are changing. All of this, and so we're all having to change and adjust to one another, to the different educational levels, to different expectations, ourselves, our patients, our managers. It's a huge mix. It's a big melting pot of stuff and things that we have to work out and figure out every single day, several times every single day. It's huge. It's huge.
Something I really admire too about younger nurses, and I think something it's equally said as like a negative, but I think that they just kind of have a lower tolerance towards like complacency or you
Yes.
mentioned like a nurse's, bringing maybe like a more novice nurse sharing, well, I think we could do this better, or have you ever thought about it doing that way? Like, I don't know about you, but like if I was in the same room with my chief nursing officer, like there might as well have been like God in the room. Like I was just, prim and proper tenure and uh,
Yeah.
I've become more mouthy since then, but I think it's like, oh, it's, I could see how it could be very irking in moments for somebody trying to, tell, what I've been doing this for 30 years and you want to
Yeah.
tell me to do it. I see that part too, but I
Yeah.
think it's cool that the status quo is being challenged.
I absolutely think it's great. I absolutely think it's great because we miss so much when we don't um are not open to new things and new ideas and different ways of doing things. We miss so much, and consequently, our patients miss something.
Yeah,
So
true. Yeah.
yeah. So you mentioned when you were talking back, you mentioned that you had experienced some burnout.
Yes.
Um, And did you do you think that you recognized at what point do you think you recognized that you were burnt out?
Oh my gosh. Yeah. I mean, many times, and I think you can get burnt out from doing like non-clinical too. Like sometimes, I'll be doing software and be thinking like, oh, do I want to just go back and get that, those dopamines of,
Yeah.
caring for people and patients and being in the same room. Um, so I think the first time I really noticed, or the first time I like had it on my radar, again, working Chicago ER, loving it, but so busy, incredibly busy. Um, and thinking like, oh my God, like how am I ever going to like, do this for 5 years or 10 years, or maybe there'd be like, a nurse in his or her like 50s working alongside me, and it just would be like a total enigma to me that they had just like sustained themselves in the workforce for so long. So I had that self-awareness that I was like probably not going to be somebody who could do the same thing forever. And I think that just kind of drove me towards doing different things as a precursor to burning out, knowing that I would I was no different than most nurses, and I would probably get burnt out as well. And then something more like discreet, like that, like moment, I think, which is you're looking for. Um, was in grad school for nursing administration, didn't know exactly what I wanted to do, but just kind of thought that having a master's would open more doors. And of course it did. But I was in a patient room, and the patient was confused, and I was trying to give a medication, and I was getting clawed at and scratched at, which I think most nurses can relate to. And I was just like, I just felt like, gosh, like I just can't keep doing this. And I gave the medication. It was K-oxalate. That was the medication too. So that, came with other treats. And it was like, okay, now I really need to pick it up into high gear and do something different. And shortly after, the hospital I was working for was going on to an EHR project, and it was a nice way to totally change pace and get unburnt out from direct patient care,
Mm-hmm.
and an
Mm-hmm.
opportunity to get burnt out in health informatics.
So, so one question I typically ask people is about self-care. What does self-care mean to you?
Everything, and I think it means more the older we get. Um, so self-care to me is just knowing that, like, I don't have like probably like a groundbreaking answer, but just knowing that the things, like drinking water, exercising, prioritizing, like, even if it's just like, putting on like a nice, lotion or something, like that, those things are equally as important as, uh, like a high paying
Yeah.
career, or like a really good, important, board meeting to prep for. Uh, and I guess I feel like I know that from having deprioritized those things, and then having more anxiety or weight gain or just all the
Yeah.
negative things that happen. And then thankful to have the awareness to course correct. But yeah, that's really what it means to me, is making those things like equal priority for your
Yeah.
total self.
Yeah, yeah. And I ask that question, I ask it of practically every nurse because I really want us to articulate it. Because we have a tendency, as you say, to put it on the back burner, further and further on the back burner, um, and pay such attention to the what we perceive as the bigger things. And as you stated, we have to make it an equal priority, regardless of how little or how simple it appears to be. As you said, it may be as simple as making sure you drink enough water. But it has to have that same level of priority. It has to be the same as other so-called bigger things.
Yeah, and we always work on it, right? I mean, it's a daily practice
It
for
has to
me,
be.
and I'm doing really well on it right now. But I've gone up and down, and I have the self-awareness that I'll, probably have like a, pizza eating season again, and have to, recalibrate.
Yeah.
But
And that's not a bad thing. Again, it's the awareness. It's the awareness. It doesn't mean just because you are paying attention does not mean that you've suddenly put yourself in a straitjacket. It does mean that you have an awareness of what you're doing and what you need to do.
mhm.
Yeah. So before we go, Patrick, is there any gem you'd like to leave us with?
I feel like I've gotten a lot of gems from you, Dale. I guess
Oh,
maybe for somebody, like for a nurse out there who is watching this, I think that like my career path, like the dots don't always connect. You can say I've done this, I've done that. Who knows what I'll be doing 5 years from now? Hopefully, cool things in healthcare and always in nursing. Just see that you can have like an unusual trajectory in healthcare and nursing, and that's cool and fun. And and if you find someplace that you love, and you want to be a career ER nurse, like that's amazing as well. But I think in with the current healthcare state, and of knowing all the burnout and really taxing things that are happening, everybody trying to solve for X with the nursing shortage across the whole world now, just
yeah.
knowing that there's a million different things to do, and just go for it. If you don't like what you change over to, your nursing job is always going to be back there.
It surely is. It surely is.
And I'll be glad to have
Patrick,
you.
they would be glad to have you. They would be glad to have you. Thank you so, so much for this conversation, Patrick. I've enjoyed it. I've enjoyed every minute of it.
Thank you. Such a pleasure.
It's my pleasure.